The tradition of removing the reproductive organs of domesticated dogs, known as neutering or castration, appears to have become the accepted norm for millions of pet owners. But how safe is this procedure in regards to the long-term health of these beloved pets? Gretel, Riva, Benjamin Hart, Thomas Farver, Anita Oberbauer, Locksley, Messam, Willits and Lynette Hart submitted their article titled Neutering Dogs, Effects on Joint Disorders and Cancers in Golden Retrievers, which was published in the Public Library of Science Journal on the 13th of February 2013. The objective of their study was to examine variables such as gender and age at the time of neutering, as opposed to leaving the dogs unnurtured. These variables were analysed, in contrast to numerous diseases. The Golden Retriever was chosen as the focus for this study due to the breed's susceptibility to a range of common joint disorders and cancers. A variety of 759 male and female dogs between the ages of 1 and 8 years, including intact dogs, dogs nurtured before 12 months of age, and dogs nurtured after 12 months, were included in the study. Each patient was examined for a diagnosis of hip dysplasia, cranial cruciate ligament tear, lymphosarcoma, hemangiosarcoma, and mast cell tumour. A patient was considered to have contracted a disease if the diagnosis was made or later confirmed at the Veterinary Medical Teaching Hospital within the University College Dublin. When a diagnosis was suspected but was inconclusive, this case was excluded from the analysis for that diagnosis. It can be observed from these results that 10% of early nurtured males were diagnosed with hip dysplasia, double the percentage of intact males. Similarly, almost 10% of early nurtured males were diagnosed with lymphosarcoma, proving to be 3 times more than intact males. There appeared to be no cases of cranial cruciate ligament tear in intact males or female patients. However, 5% of early nurtured males and 8% of early nurtured females had the disorder. The 8% of hemangiosarcoma cases diagnosed in late nurtured females was 4 times the occurrence of intact females. Furthermore, the occurrence of mast cell tumour was nearly 6% on late nurtured females, with no cases observed in intact females. The results of this study greatly reflect the author's concern that early nurturing of golden retrievers drastically impacts their growth and development. It has been concluded that gonadal hormones in a dog play an essential role in controlling the closure of bone growth, therefore resulting in higher occurrences of joint disorders in nurtured dogs. Although the link between these hormones and the appearance of cancer is somewhat less obvious, it has been speculated that estrogen secretion may sensitize the process of microsatellite instability, which is necessary in protecting against cancer cell activation. Essentially, the results presented throughout the study indicate a significant importance to golden retriever owners to acquire relevant information in order to make an informed decision on whether or not to nurture their dogs.